A Russian airstrike on a maternity and children's hospital in the city of Mariupol has triggered global outrage and condemnation.
One of the biggest targets of Russian attacks has been hospitals. President Zelensky says that at least 400 healthcare institutions have been destroyed so far.
Почему уничтожают наши дома, почему уничтожают больницы, школы, инфраструктуру? Для чего нас отсюда выгнать, или не знаю, или геноцид полный сделаем, товарищ Путин. Вот это у нас была невравнение. Белили, красили, крыша капает с люстры, как так называемые.
Valentina Moskova lives in the basement of a damaged hospital in Ukrainian city of Krasnoyarvika. She was a lab technician who now works as a security guard in the hospital building bombed out ruins.
Свет выключили у нас после обстрела. Идем на работу дальше.
Russian artillery strikes targeted Marinskaya Central District Hospital in 2017 and again in 2021. But numerous barrages over the last 7 months forced the hospital's medical staff to flee, destroying key departments such as neurology, gynecology as well as general medical clinic in process.
Кабинет заведующей отделения. Вот видите, перестенок весь ушел, и плита перекрытия уже почти упала там.
Having worked in the hospital since the late 1980s, Moskova chose to stay and work as a hospital security guard for $250 a month. She picks up the broom at 8 a.m. sharp every 3 days to inspect the hallways, carefully avoiding the fragments of Russian-grade rockets strewn across the floors for fear of yet another explosion.
On March 3, it was in Chernihiv. In the very center, unguided bomb fell on the residential area. 47 people died. Cardiac hospital was destroyed, right? Izium, 5 days later, March 8. Same thing, center of the city, plane, unguided bomb, hospital destroyed. March 9, Mariupol, same thing, center of the city, unguided bomb, hospital destroyed. And if you look at geographical locations, you clearly see that this is different parts of the country, and that means it's not one unit who made a mistake or a series of mistakes, or one commander was an evil person or whatever. It was 3 different groups of troops. It was 3 different locations, 3 different high-level commanders, and that suggests that definitely was a deliberate way of conducting war, the deliberate tactic of war.
In Izium, explosives ripped through the main hospital's walls in March, shredding its wiring and forcing doctors and patients into the basement.
Ну, смотрите, это у нас операционная была налево, прямо коридор, и там 2 операционные было. С правой стороны отделение анестезиологии. Это стучит, вот это мост сделали, стараются восстановить. Ну, у нас всі відділення постраждали. На теперішній час неможливо надавати медичну допомогу на 4-му поверсі із-за того, що там криша постраждала і трохи підтаплювання. Ну, вода затікає, але я думаю, що це ми впораємося з цим. У нас не було операційної, тепер ми вже виконуємо операції.
A year into Russia's war in Ukraine, hundreds of attacks against the healthcare system have begun to take a toll. According to a joint research by Eyewitness to Atrocities in Security Insight, the Media Initiative for Human Rights, Physicians for Human Rights, at the Ukrainian Healthcare Center, Russia has targeted the Ukrainian healthcare system deliberately and indiscriminately, amounting a war crime.
The attacks that happened in Ukraine against healthcare, and we reported overall 707 of them, The most interesting about them is that they follow specific patterns, and it is those patterns that are important, not even the number, not even the geographical distribution, but the patterns, because patterns mean that most likely was a deliberate policy, not just a bulk of coincidence or separate events.
The report Destruction and Devastation, 1 year of Russia's assault on Ukraine's healthcare system, found that between 24th of February 2022 and 31st of December 2022, there was an average of more than 2 attacks a day on healthcare, with a total of 707 attacks on Ukraine's medical system. That included 292 documented attacks that damaged or destroyed 218 hospitals and clinics. It also included 65 documented attacks on ambulances and 191 attacks on other parts of the infrastructure, such as pharmacies, blood centers, dental clinics, and research centers. There were 86 attacks on healthcare workers, with 62 workers killed and 52 injured. Survey by an international organization for migration found that as of the beginning of December 2022, 1 in every 3 Ukrainians were experiencing a lack of medical services. The report Destruction and Devastation defines attacks not just as weapons strikes, but also threats aimed at forcing doctors to keep working in occupied territories and incidents of theft in areas that Russian forces failed to hold on to. Ukraine's health minister recently said that more than 1,200 facilities have been damaged either directly or indirectly, with 173 hospitals damaged beyond repair. In the city of Kherson, residents said retreating Russian forces took most of the ambulances with them. As they captured the city of Mariupol, the Russians took over the city's last functioning hospital, days after a Russian airstrike devastated a maternity ward. Ukraine had the second highest number of HIV infections in Europe and Central Asia, and one of the highest rates of drug-resistant tuberculosis. But since the invasion, the number of people being treated for these ailments has dropped, and it's harder to follow up or track new infections because of the mass displacement of Ukrainians within the country and across Europe. And beyond day-to-day healthcare access, the conflict has impacted clinical trials, medical education, and services for cancer, diabetes, cardiovascular conditions, and perinatal care.